Okay, Mrs. Jenkins, I'm now going to get your indwelling catheter kit ready. So this will be the trash bag for my procedure. And this is at the end of the bed, in between the patient's feet. That's really good. So now I'm going to take off the covering. So I'm going to make sure that it is away, which this is taped, so kind of bear with me. So away, side, side, and then towards me. But I'm going to have to help this side since it is taped. I'm going to really try to make sure I'm maintaining my sterility. That 1-inch border. So, there it goes. Okay, so I'm going to move this up by not leaning over it and just making sure it's in the right position. Well, only moving it by that 1-inch border site. So I'm now going to perform hand hygiene. I'm going to put on some gloves to get my absorbent pad out of my kit. Okay, so now I'm going to pick up my absorbent pad. Alright, so I'm going to make sure that the reflective side is down. Ensures that the absorbent side will actually absorb. And if the patient's able to assist me in putting these under their legs, I would have them assist me, but only if the patient's able to. Okay, and I also wanted to make sure that it said that I would have this way higher, my tables, but this is the best I can do for making this high as I could, but I would make sure this would be significantly higher if I was in a normal healthcare setting. Okay, so I'm going to take these off, perform hand hygiene, and now I'm going to don my sterile gloves on. Okay, so that is my cuff line. I'll fold this, and make sure I'm within that 1-inch border. For my gloves, okay, right here. Okay. So we'll pick it up at the base. This one. And then directly. So I'm going to pick up the middle and I'm going to throw that away. Okay, so now I have my sterile gloves on. I can now pick up my solution that will be going onto my cotton balls. So I take out the tab, pour the solution onto my cotton balls, and then throw it away. Next, I will be taking the plunger off my lubricant, get rid of the plunger, and then I will be using this, but not quite yet. So I'm going to make sure it's up so it just doesn't pour lubricant over everything. So now that my lubricant's ready and my cotton balls have their solution on them, I'm now going to move this kit over just about where there's 2 inches on the border, even though it is an inch, but I want to be like overly careful. And now, since I am have that appropriate side or appropriate length on this side, I can now pick up this top tray and put it where they both fit with that 1-inch border. Okay, so I'm going to pick this up, place this directly next to it, and I have about 2 inches on both sides, so we're doing good. Okay, so now I'm going to pick up my pre-filled syringe. That will be going into my balloon port. I am now going to connect that. Okay. And then with that being in, I'm going to get my blue sheath, or take my blue sheath off of the catheter. And since this is the most important part, I'm going to make sure I have complete control of it. And it's the most important part because it's the invasive part of the catheter, so it will be going in the body. So I'm just going to make sure that I have a lot of control of it. Okay, and then I would throw that away. And since my hands are still both sterile, I'm going to help this hand out. I'm going to make sure that's in. And now I will be utilizing that lubricant I was talking about before. Into the lubricant. And now the catheter is in the lubricant syringe, so that is there. And now both my parts are ready for use. So since they're both sterile, because they're not on that 1 inch border, they're within the appropriate length on both sides, and it's not on my side table, I can now pick up this one, this top part, place it on top, since they're both still sterile. Just gonna make sure it's on, and then I'm going to pick this up over my patient's legs, maintaining sterility onto the bed. Okay, so now that I am where I need to be now, I can now inform my patient that I will be using my left hand to help with peritoneal cleaning, and my right hand will be the hand that remains sterile throughout the procedure. So Ms. Jenkins, I will now be cleaning your peritoneal area, and this does require me to use my left hand to help assist in that cleaning, but I want you to know that after I'm done cleaning, that hand will stay there, just because I want to maintain that hand there since it's not sterile anymore. And I just don't want you to be alarmed by this. It's typical procedure, and my hand won't be moving until the catheter is inserted and properly put in, okay? So I am now going to touch the labia fold to help spread out for cleaning, and now my left hand will not be moving, my non-dominant non-sterile hand. I'm now going to use my sterile hand to pick up a cotton ball that's filled with my solution, and I'm going to do, okay, there we go. I'm going to do the further side fold first, all the way down in one motion, and then around my sterile field, and then I'll get another one, and this will go on the side closer to me on the fold, down in one motion, around my sterile field, and drop. Now my last one will be from the middle, and it will go from the clitoris all the way down to the anus. One motion down, around my sterile field, drop. And now that I'm done with these, I can drop these. And I technically did have them covered, but for complete safe measures, I still went around my sterile field. And then my left hand is still not being moved. So now this hand is still sterile, so I can pick this up, move it out of my way, and drop it. Which I wouldn't drop this if it was a normal patient, because they would be at my waist level, so I wouldn't have to worry about going below that waist level. But I just really want to show that I let that go in a still sterile spot. Okay, so now that the peritoneal cleaning has happened, I'm now going to inform the patient that the catheter will be inserted at this time. So Mrs. Jenkins, I will be inserting the catheter. During this time, I want you to keep breathing. Nice, deep, controlled breathing, and I want you to let me know if you have any extreme pain, okay? Okay, great. So I am now going to take my catheter top out of my lubricant, and I am now going to be inserting through the urethra while spreading those labial folds. And I'm going to keep going until urine starts flowing out. So we'll say urine is starting to flow out now. So once I get to that point of urine coming out, I'm going to go a couple inches higher just so I can secure that balloon port area. So we're about a couple inches higher. So now that we're at where the catheter needs to be, for the balloon to be inflated, I'm going to move from the labia and the folds to securing that catheter tubing just because it is where it needs to be. Next, I will be inflating the balloon. So I am now inflating the balloon. Okay. And keep going until we are done. Doing great, Ms. Jenkins. And now that is done, I'm going to get my prefilled syringe out of the balloon port. And now that the balloon is inflated, I can now check this to make sure that it's in its proper position by pulling gently back just to make sure that it doesn't dislodge or go out of movement. There's a little resistance met, and which there is, so that's good. So that means the balloon is where it's supposed to be, so the catheter is secured for now. So that means since it is secured for now, I can let go while preparing my tape just to anchor for extra precaution for making sure that catheter stays where it needs to be. Okay, so I will be taping the tubing to the medial thigh of the patient, So since I actually don't have legs or an actual thigh or an actual patient, I will say that this area right here will act as the medial thigh, which is kind of close to. Okay, and I'll do one more just for safe measures. Okay. So now that this is secured, I can now take out the entire unit. I can actually throw this over now. I'm going to take out this, and then I'm going to put the bag. Oh, okay. So I'm going to put the bag below the patient's bladder. So I'm going to make sure that it's not overly kinked because this could cause patency problems. So, alright. And like I said, the bag will be on a non-moving part of the bed just so it doesn't get displaced. And then I'm going to make sure that the bag is where it won't be tampered with. And I'm also making sure that it's below the patient's bladder. So as I'm setting up this bag where it's going to be, I'm going to assess the urine that is flowing out. I'm going to be assessing its consistency, amount, and color. So after assessing for those, I would then make sure that the urine is flowing freely. So we'll say that all three of those check off and the urine is flowing freely. And then after this, I would now be helping my patient just get back to nice, safe, comfortable measures. So I would move this, get rid of this, throw this away for her, get this out of her way. I would then cover up. And then after making sure that my patient's completely comfortable and safe, I can now say that the insertion is done, and I would remove my gloves and perform hand hygiene.